they demanded 10 lakh rupees advance because they said that the neonatal ICU, would cost 10 lakh rupees per child. The family stated that we would certainly do that, and we're ready to give 3 lakh rupees now. And when they went to the reception center, they were declined and said that no, you have to give minimum 10 lakhs. And despite calls from political leaders, officers in Mumbai, because this patient was the personal assistant of one of the BJP leaders in Pune. It took the death of a mother who died with her breast milk still on her body, and twins, two daughters, who have become orphaned for the for the reason of medical negligence. It's like they know, Deenanath Mangeshkar Hospital probably knows that after a few days, public memory will wane and everything will be forgotten. Let us, come together to clean up the system. For heaven's sake, you can't be playing with human beings. The your patients are being treated like products. They're being treated like money spinning machines. Pune is the hub of multi-speciality hospitals, which comprise private hospitals as well as charitable hospitals. Deenanath Mangeshkar Hospital, which is attached to the Mangeshkar family, the name, because they started to build this hospital with a lot of donations from people from Maharashtra. It began with service to the poor and the rich alike, whichever the patients came into the hospitals. Over the years, it kind of got a little tainted reputation of asking for advance. But then that's with all the private hospitals. So what's difference now? The difference was that when this young lady, mother to be, was to deliver twins, she had an emergency because she started her labor pains at 7 months. And since she was on record, uh, uh, you know, going to that hospital under the gynecology department, Dr. Ghaisas was a gynecologist who was attending to her. She naturally went there because she got severe pain. However, they demanded 10 lakh rupees advance because they said that the neonatal ICU, would cost 10 lakh rupees per child, and hence it is 20 lakhs. So they should be at least paying 10 lakhs. To which the family stated that we would certainly do that, and we're ready to give 3 lakh rupees now. And when they went to the reception center, they were declined and said that no, you have to give minimum 10 lakhs. And despite calls from political leaders, officers in Mumbai, because this patient was the personal assistant of one of the BJP leaders in Pune. But the accounts head would have nothing of it. And Dr. Shashwat Ghaisas, who is the gynecologist, allegedly also put pressure on the family to pay the entire amount. This took 3 to 4 hours altogether till they were rushed to another hospital, wherein after I think a day, she delivered the babies, but she passed away. Hence, the family alleged that if the Deenanath Mangeshkar Hospital had given her immediate attendance, probably they would not have seen the death of this young mother to be. So that's where the entire controversy started. And it got support from citizen groups, other than the other political parties too, because private hospitals in Pune have been getting have been you know asking for more money, as alleged by several patients, mishandling patients. So Deenanath Mangeshkar actually became the representative. It became the trigger, and it was like the last straw on the camel's back when this kind of a death and the obnoxious kind of money demanded immediately, like made the people really angry. However, the Deenanath Mangeshkar Hospital for the first 48 hours, refused to comment and stated that they are going to form a committee. And after having formed the committee, unfortunately, they gave out a press release which recorded some of the personal details of the patient and trying to defend themselves. But when they found that there was immense pressure, because the Marathi media really took it up very well, and so did the people on the roads, and so today they have come to a conclusion that yes, there has been some wrong done by the hospital, and Dr. Dhananjay Kelkar, who is the head, he has published a press release and sent it across stating that they have decided from now on that for various categories of patients, they are not going to ask for advance at all. However, strangely, the Deenanath Mangeshkar Hospital was getting support from several citizens and several organizations. But however, they had to go back because the media stories were really so hard hitting that even during the panel discussions on television, there was really no panelist who was trying to who could defend the Deenanath Mangeshkar Hospital. Now, this is, unfortunately, that it took the death of a mother who died with her breast milk still on her body, and and twins, two daughters, who have become orphaned for the for the reason of medical negligence. And hence, it is time to really wake up, because this issue will die down after 2 to 4 days. But however, it is time to clean up the entire private hospital system that has become so money minded in a city like Pune, that many patients who suffer, who give complaints to the hospitals, to the Pune Municipal Corporation, to the health authorities, are not being attended to at all. Even Chief Minister Devendra Fadnavis, finally, he too came on record to say that the Deenanath Mangeshkar Hospital definitely needs, whoever is responsible needs to be punished. However, put in a rider there that it is not the entire fault of the hospital. And that's really wrong. I don't know why political leaders are coming forward with riders, because this is a clean case of demanding money, which is not at all legal and not at all under medical ethics as per the act which is there in Maharashtra. I think it's called the Maharashtra Nursing Act. So where is the question of people stating, "I let the investigations get over"? Where is the question? You have denied a patient for the want of money. And when comedians crack some jokes which do not hurt anybody, they are immediately, the police go there and they have to get arrested, and there's a big hue and cry. You don't know Marathi language. Raj Thakre's political workers go to bank managers and then threaten them. And when here a life has been lost, when a young lady for no fault of hers has lost her life, despite her family appealing, calling up the influential people, eh, there is no word from Mr. Raj Thakre. Why? I mean, isn't this a more serious issue than a comedian giving names to somebody? So this is the way that a nexus has been formed. It's like they know, Deenanath Mangeshkar Hospital probably knows that after a few days, public memory will wane and everything will be forgotten. But no, like today itself, some of us citizens have decided that we should help the media to further amplify this case. And we are going to come together and try to hold a campaign. We would like the public who to send complaints to us of any medical negligence, any demand for obnoxious money that any private hospitals or charitable hospitals have made in Pune, so that we can collect all these cases and go and address it to the chief minister, to the health minister, and all the relevant authorities. So this is a black blotch in the field of medical profession in Pune, and probably it happens in several cities across not only Maharashtra but across India. So we will have to, as media persons, as citizen groups, as authorities, and as law enforcing authorities, let us, come together to clean up the system. For heaven's sake, you can't be playing with human beings, their money, their emotions. In this lady was in intense labor and pain, was told in front of her, like her sister-in-law, that is her nanand, and her husband, who were also kept in the side room for want of the 10 lakh rupees, which was not given, was bluntly told on the face that, if you cannot afford this kind of money, please go to the Sassoon General Hospital. Isn't there any sensitivity? So in front of sensitivity, money, no sensitivity is left. The your patients are being treated like products. They're being treated like money spinning machines. And this needs to stop. And all of us have to come together.